Good morning, doctor and friends. First, let me introduce myself. My name is Lurut Rumsidi, with the last digit of my student number is 135, SGD B3 representative, who will start the presentation today with the title Embolic Stroke with Hypertension and Hemiplegia. Here are the members of SGD B3. Now we will go to chapter 1 introduction. First of all, background. So, embolic stroke is caused by a blockage in brain blood flow, and it's account about 17% of ischemic stroke, often in younger individuals. For the key risk factors, including hypertension, atrial fibrillation, and patent foramen ovale. Addressing this requires a health system approach that integrates efficient diagnostic, holistic care, and prevention strategies. Next slide. Effective management of this disease starts with advanced diagnostic like diffusion weight imaging or DWI for small stroke detection and D-dimer test for cardioembolic causes. Health system must promote interdisciplinary collaboration and family-centered care to address the emotional and caregiving burdens of stroke. Long-term strategies, including rehabilitation and education, are essential for improving outcomes and preventing recurrence. A systemic approach ensures comprehensive care for patients and their families. Therefore, this literature review titled Embolic Stroke with Hypertension and Hemiplegia need to be compiled and presented by focusing on the health system best practice approach. Maybe that's all from me. I give it to my friend. Thank you.
Hello, my name is Nyoman Aimedira Amanda with last digit of student number is 070. Now I will explain about the problem formulation. To ensure the problem formulation, we have broken down into the following questions. First, what is the examination of embolic stroke? Second, what are the risk factors of embolic stroke? Third, what family interactions impact the embolic stroke? Fourth, what is the impact of the disease to the family? Fifth, what are the family medicine for embolic stroke? The objective of the student project is to identify the diagnostic examination for embolic stroke, to analyze the risk factors of embolic stroke, to examine the family interactions that impact embolic stroke, to evaluate the impact of embolic stroke to the family, and last is to analyze the family medicine for embolic stroke. So for the theoretical benefits, the student project provide deeper knowledge regarding the embolic stroke with hypertension and hemiplegia, and provide as reference for further research of embolic stroke with hypertension and hemiplegia. For the practical benefit, the student project provide practical guidelines for healthcare professionals in diagnosing and managing embolic stroke, and provide practical recommendation for families dealing with embolic stroke. So that's all from me. Thank you.
Hello, my name is David Christopher Chandra with the student number 066. And now I would like to start the second chapter, Literature Review. I would like to present about the identification of examinations. The first one is clinical examination, which is crucial for identifying the primary symptoms and assessing the patient's overall condition. Symptoms such as hemiplegia is typically evaluated through physical examination and motor strength assessment. A tool for assessing stroke severity is called the National Institutes of Health Stroke Scale, or NIHSS, which provides a comprehensive evaluation of neurological function, determining the severity of the stroke and predicting the patient's prognosis. Blood pressure evaluation is also crucial and essential, as hypertension is a major risk factor that accelerates the damage to the cerebral blood vessels and triggers the embolic stroke. The second one is imaging examinations, which confirms the location and the nature of the blockage in embolic stroke. The initial step commonly taken is the non-contrast CT scan, which quickly identifies hemorrhagic stroke and rules it out in embolic cases if negative. Unfortunately, this examination is limited in detecting early ischemic lesions. Next one is the diffusion weighted MRI or DWI, which is more sensitive than CT for acute ischemic infarction and small lesions. It is an advanced imaging and used when CT results are inconclusive. And then the next one is the CTA and MRA, which identifies the blockage and assesses the blood flow in more detail. This is very beneficial for patients with arterial disease or arterial fibrillations. The third one is the additional examinations, which helps to identify the source of the embolus, particularly from the heart. First one is the echocardiography, which detects blood clots or structural abnormalities causing emboli. This is very essential for patients with atrial fibrillation or cardiac abnormalities. Next one is the electrocardiogram or ECG, which helps in detecting arrhythmias, which can trigger the formation of emboli that eventually block cerebral blood vessels. Then the lab test, which measures cholesterol, glucose, and CRP to assess atherosclerosis and inflammation. This identifies the risk of impaired blood flow and embolus formation.
Teachers and friends, first of all, let me introduce myself. My name is Anastasia Andretan and my last three digit numbers are 154. Here I'm going to explain about the identification of risk factors. Modifiable and non-modifiable risk factors both contribute to the increasing risk of embolic stroke. Some modifiable risk factors of stroke include uncontrolled diabetes mellitus, hyperlipidemia, atrial fibrillation, and also hypertension. Diabetes mellitus cause severe disability and slow discovery. Hyperlipidemia is associated with increased risk of stroke, however, it is still unclear. Atrial fibrillation causes high disability and mortality rates in stroke patients, and also hypertension is the leading modifiable risk factor of stroke. It is caused by narrowing of blood vessels in the brain, leading to cut-off of blood supply. Non-modifiable risk factors include age, which is seen in 60 to 72 years of age, gender, which is mostly in men, and also ethnicity, mostly in African ethnicity, and also family history and previous history of smoke. Lifestyle factors include alcohol consumption, obesity, and also sedentary life, and also cigarette smoking. Hemiplegia is also common in stroke patients. Stroke with hemiplegia has several risk factors, including impaired motor control, reduced proprioception, sensory impairments, spasticity of elbow flexor muscles, and also limited range of motion. That is all from me. Teachers and friends, first of all, let me introduce myself. My name is Anastasia Andretan and my last three digit numbers are 154. Here I'm going to explain about the identification of risk factors. Modifiable and non-modifiable risk factors both contribute to the increasing risk of embolic stroke. Some modifiable risk factors of stroke include uncontrolled diabetes mellitus, hyperlipidemia, atrial fibrillation, and also hypertension. Diabetes mellitus cause severe disability and slow discovery. Hyperlipidemia is associated with increased risk of stroke, however, it is still unclear. Atrial fibrillation causes high disability and mortality rates in stroke patients, and also hypertension is the leading modifiable risk factor of stroke. It is caused by narrowing of blood vessels in the brain, leading to cut-off of blood supply. Non-modifiable risk factors include age, which is seen in 60 to 72 years of age, gender, which is mostly in men, and also ethnicity, mostly in African ethnicity, and also family history and previous history of smoke. Lifestyle factors include alcohol consumption, obesity, and also sedentary life, and also cigarette smoking. Hemiplegia is also common in stroke patients. Stroke with hemiplegia has several risk factors, including impaired motor control, reduced proprioception, sensory impairments, spasticity of elbow flexor muscles, and also limited range of motion. That is all from me.
Hello everyone, my name is Priscilla Wijaya, with the last three-digit name is 236, and I will explain 2.3 identifications of family interactions, especially for the genetic part of the family. So ischemic stroke, or particularly embolic stroke, is a multifactorial genetics conditions resulting from the interplay of numerous genetic and environmental factors. We have collected two studies. The first one is from Choi et al. 2009, shows that their understandings of the genetic underlying complex stroke has significantly enhanced. And the second one is from Johan et al. 2016, observed that a positive sibling history is higher than compared to a positive parental history. So we can conclude the genetic part of a family plays a role for a embolic stroke of a patient. Maybe that's all from me that I could explain. The next one will be explained by my friend. Thank you.
Hello, my name is Niputu Dinda Prameswara with my study number is 130. Now I want to explain about family habits. The risk of embolic stroke can influenced by lifestyle factors including family habits. For the first one is unhealthy diet. Research shows that families with high fat, high salt diets are at a greater risk of cardiovascular disease and stroke than families with healthier eating patterns. For the second one is lack of physical activity and families. Many families engage in sedentary lifestyles, such as sitting for long periods while watching televisions or using electronic devices. This lack of activity increases the risk of obesity, hypertension, and diabetes, all of which are risk factors for embolic stroke. Third is impact of smoking habits in families. Smoking causes inflammation and damage to blood vessels walls, which facilitates plaque formation and increases the risk of blood clots that can lead to embolic stroke. Fourth, excessive alcohol consumptions. Families with habits of heavy alcohol consumptions increase their members' risk of high blood pressure, which is a leading cause of stroke. Fifth is poor management of blood pressure and diabetes. Poor management of blood pressure and blood sugar levels in families can greatly elevate stroke risk. And the last one is lack of health education in families. Educational programs provided to families about the importance of a healthy diet, physical activity, and managing blood pressure and blood sugar levels can help reduce a stroke risk. So that's all from me. Thank you.
My name is Putu Krishna Arsawarni Putri with last digit number 027, and I will present about the impact of embolic stroke on family. The impact of stroke is substantial and often affects not only the individual but also those around them, including family members. Following hospital discharge, the majority of stroke patients undergo home care, with family members as caregivers. Home care has been shown to create significant stress for caregivers, often compromising both health and quality of life. Family members may struggle to adjust to a caregiving role, which may result to emotional distress and reduced physical and social health. Providing home care to patients with stroke may also cause financial strain to the family. Maintaining financial stability after a stroke is challenging, as family members often struggle to balance work with caregiving responsibilities. Stroke also significantly affects family relationship and alter family dynamics. Parents who have had a stroke may be unable to fully resume their parental responsibilities. Marital relationships are also significantly impacted due to role changes. Stroke survivors also frequently face communication challenges due to speech disorders. As a result, families may struggle to maintain clear and meaningful interactions, affecting the emotional connections between family members.
Hello, my name is Kadep Pamudia Gastiakana, with my last three-digit number is 165. Now I will continue the presentation. So, for the social impact of an embolic stroke on a family can be significant, often leading to isolation, stigma, and shift in relationship. With caregiving demands may cause family members to withdraw from social activities and neglect personal interests, which leading to feelings of loneliness and detachment. And in some cultures, visible impairments of behavior change in the stroke survivor can result in stigma, further limiting the family social interaction. Within the household, relationship may evolve as certain members take on more caregiving responsibilities, which can create tensions or conflict if not managed effectively. And for the caregiving challenge also places a considerable strain on families, both physically and emotionally. Tasks such as lifting, bathing, and attending to medical needs can be exhausting, particularly for those untrained in healthcare. Without adequate knowledge or resource, caregivers may feel overwhelmed, leading to burnout and emotional fatigue. However, with proper education and access to community support, families can learn to navigate the recovery process more effectively. That's all from me. Thank you, and my friend will continue the presentation.
My name is Dibana Siva with last digit 121, and I'm going to present about family medicine for embolic stroke. Family physicians play a critical role in prevention, diagnosis, and management of embolic stroke. By actively engaging in risk factor management, early detection, prompt evaluation, acute care, and long-term follow-up, family medicine physician can significantly improve the outcome of patients with embolic stroke. A multidisciplinary approach involving primary care provider, neurologists, cardiologists, and rehabilitation specialists is crucial for comprehensive care. The role of family medicine for embolic stroke divided into several approaches such as comprehensive approach, collaborative approach, and continuing approach, and also several efforts such as primary, secondary, and tertiary efforts.
So hi everyone, my name is Katra and I'm with illustrations number 009. I would like to explain about the comprehensive, collaborative, and continuing approach in embolic stroke patient. Managing embolic stroke patient requires a thorough, comprehensive, collaborative, and continuing approach. This includes immediate intervention, long-term prevention, and ongoing rehabilitation. Immediate intervention consists of a diagnosis that is carried out quickly and accurately. Early diagnosis can be performed using head CT scan or MRI. Long-term prevention for patients with embolic stroke also needs to be taken into account to prevent the recurrent damage in the future. Several options for long-term prevention include antithrombotic therapy, hypertension management, and risk factors assessment and control. Ongoing rehabilitations or continuing approach for patients with embolic stroke, including physical therapy, psychological screening, and social support. This can help improve the patient's quality of life in a post-stroke period. That's all from me. Next will be explained by my colleague. Thank you.
Good morning, Doctor and friends. My name is Jose Pinelo. The last three digits of ID number is 094. Primary efforts involves efforts taken before the onset of disease or injury to prevent them from occurring in the first place. These measures are directed at reducing risk factor and promoting protective factor within the population. Primary efforts of embolic stroke focus on intervention to mitigate the risk factor before the occurrence of a stroke, reducing its incidence and associated with health burden. Public health efforts are also important in prevention of embolic stroke. Raising public awareness about embolic stroke prevention through health campaigns and community-based screening for hypertension, which are integral components of a public health approach. Early detection of asymptomatic cardioembolic events through community programs significantly reducing embolic stroke risk. Furthermore, public health campaigns targeted hypertension play a vital role in health education and promotion in embolic stroke prevention, where hypertension is a leading modifiable risk factor. Lifestyle modifications such as regular physical activity, healthy diet, and smoking cessation are essential to prevent stroke. A diet rich in fruits, vegetables, and unsaturated fats are associated with reduced risk of cardiovascular disease, including stroke. Regular physical activity, at least 150 minutes per week, improve overall cardiovascular health and reduce embolic risk. Government policies that support public health infrastructure and resource allocation enhance primary prevention efforts. Examples including implementing taxation of tobacco products to reduce smoking rates that can lead to cardiovascular disease. Equitable access to health service, ensuring the population at risk receive adequate screening and prevention care. That's all for me. Thank you.
Let me introduce myself. My name is Igusalana Agung Libraun Dharmalaksana with three last digit of student number R029. I want to explain about secondary and tertiary effort in stroke embolic with hypertension and hemiplegia. Secondary efforts refer to interventional measures to prevent recurrence. In this case, secondary efforts are aimed at preventing recurrence of embolic events, improving health, and minimizing nerve damage. The intervention action that can be taken are antithrombotic administration, blood pressure control, risk factor control, and compliance with primary efforts. Meanwhile, tertiary efforts refer to rehabilitation measures to improve the quality of life patient after treatment. Some of the things that are the focus at this stage are reducing disability, improving quality of life, and reintegrating into the community. In this case, tertiary efforts that can be done are rehabilitation program, prevention of complication, psychological support, and encourage to return to the community. That's all from me. The next will be explained by my friend. Thank you.
My name is Madhya Irania Parawita with last three digits student number is 226. So today I will explain about the conclusion. So the project highlight the integrate relationship between hypertension, a key modifiable risk factor, and embolic strokes, particularly those resulting in hemiplegia. It emphasized the importance of accurate diagnosis, timely intervention, and comprehensive prevention strategies, including primary, secondary, and tertiary measures. To minimize complication and improve patient outcomes beyond medical management, the project explored the role of unhealthy lifestyle, such as poor diets and smoking habits, in increasing susceptibility to hypertension and strokes, while addressing the emotional and financial burdens on families. By advocating for family education, involvement in care decision, and promotion of healthier lifestyle, the project presents a holistic approach to reducing stroke incidence and enhancing long-term wellness for both patients and their families. And okay, that's all about our presentation. We apologize if there are any mistakes and thank you for your attention.